Hi, I'm Taylor. I'm going to be doing a collection for wound culture. So the first thing that you're going to do when you get the order is you're going to verify the provider's orders, and then you're going to gather all of the necessary equipment. So you're going to do gloves. If you're going to be changing the dressing, you're going to be getting new dressing. You're going to get antiseptic wipes to clean the area. You're going to get the little culture. So this is my wound for today. And then going to perform hand hygiene and then provide privacy for the patient. You're going to introduce yourself. You're going to verify the patient with 2 patient identifiers, so name and date of birth. And then you're going to make sure that there's no signs and symptoms of any infection, so fever, chills, or excessive thirst. Asking what the rate of the pain is. So you're going to apply clean gloves. So I have these right now. And then before you do the culture, you're going to inspect the area. You're going to clean the area around it, or on this side. And then you're going to do the swab. So I have my swab here. And depending on if it's anaerobic or aerobic, depends on how far in you're going to go into the wound. So if it's aerobic, you're going to take the swab and you're going to do the tip of the swab into the wound area of the fresh drainage. And then for the anaerobic, you're going to insert the swab deeply into the wound. So it's further in so the less air is able to get to it. And then you're going to pull it out like this. You're going to make sure that you're getting the area. And you're going to put it back in. You're going to label the specimen. Usually they have labels printed out with the name, the date of birth, what it is, and then if not, then you'll just write on the label. If they're taking any antibiotics, you'll write on the label as well. And then you're going to change your gloves. You're going to put on new gloves after performing hand hygiene. And then you're going to readdress the wound, putting another sterile dressing over it. All right, so today we're going to be collecting a sputum specimen. So I have my son here. He's going to help me. We're going to be first verifying the physician's orders. We're going to gather the equipment and the supplies. So I'm wearing gloves, and then also the specimen container, which is still in the packaging. And then we're going to perform hand hygiene, provide patient privacy, ask patient name and date of birth. What's your name and date of birth?
Connor Lee.
And your date of birth?
2013.
What month?
January.
What day?
The 7th.
Okay. And then we're going to ask the patient how he's feeling, if he's feeling short of breath, if he feels like anything's in his throat. And then I'm going to have the patient rinse out his mouth with some water. And then make sure that he has not had any mouthwash, toothpaste before collecting the specimen, as it can interfere with the collection and the results. So we're going to open the container. All right, do not touch the inside of the container. Okay, so you got to hold on the outside. Perfect. All right, so take in 3 or 4 short, deep breaths. One more. All right, and then on that last one, you're going to do a forceful cough. So do it again. 1, 2, On that last one, you're going to cough into the cup. Ready? Spit. All right, and then we're going to do this 3 or 4 until we get about 5 milliliters of fluid. With him, it's just spit, so it's kind of harder to do it because it's not actually phlegm or mucus or sputum. And then once we're done, we're going to put the cup on. We're going to make sure it has a patient label, and then we're going to send it down to the lab for testing. So now we're going to do range of motion. For the head, we're going to make sure that we have our hand on the back of the spine so we can feel and see if there's any pain, or not pain, moving of it, any crackling, any popping. So go ahead and touch your head to your chin, or chin to your body. Okay. Go ahead and go back up. Put your head back up. Go ahead and go side to side. Side to side. Does that hurt at all?
Nope.
What about the other way? Okay. And then go ahead and look at the sky. Nice and slow. Go ahead and look back down at your tummy. Good job. Does that hurt at all? Any discomfort? Yeah? Where?
Nowhere.
Discomfort's pain.
No.
Okay. All right. And then the next one we're going to do is we're going to do the elbow. So you always want to make sure that you have a hand on the elbow. You're going to go away from the body, toward the body, go back into position. And we're going to do that a couple times. This is to make sure that you're able to eat. Okay. The next range of motion we're going to do is the wrist. So the wrist is kind of floppy. This is to help make sure that you can pick up stuff, grip stuff, eat, and also write your name. So go ahead and bend it backwards. Good job. Go back to the starting position. Go forward. Are you able to do this? Does that hurt at all? Perfect. Good job.